Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over the real reason for hypothyroidism. I actually, from my personal experience, because I used to suffer from hypothyroidism, and actually I had thyroid cancer, and I had at least 8 doctors that worked with me to help me with my thyroid gland, but unfortunately none of those doctors actually looked at this mineral that I'm gonna go over in this video, and it has a very essential function for the thyroid gland and actually could lead to hypothyroidism. So before we start, actually, I'm gonna go over the thyroid function. We need to really understand what the thyroid gland do to the body. And we'll go over the symptoms of the hypothyroidism and the real reason why you might have hypothyroidism. There are several reasons, but this is one of the overlooked by a lot of healthcare providers, and one of the very essential minerals that require for the function of the thyroid gland. And we're gonna go over how to improve your thyroid function. So first, the thyroid gland function. So as you see in the image here, the purple colored, that's where the location of the thyroid gland. It's right in here. It's look like a butterfly shape. It has 2 sides, left and right. So the main function of the thyroid gland is actually maintain all organs function through control metabolic rates like your breathing, your heart rate, your blood pressure, your cell production. To simplify it, it's basically the gland that actually control the speed of all the organs in your body, or control the metabolism of your body in relation to the function of your liver, kidney, adrenal gland, your brain. Everything depends on the thyroid gland to function properly. And the other main function of the thyroid gland is actually convert food to energy. So if you don't have enough of the thyroid hormones that's actually produced by the thyroid gland, your body will not convert food to energy. And actually that's one of the main side effects is increased weight and building fat. So it helps to for the protein synthesis and actually metabolism, fat and carbs. It also regulates your body temperature. So one of the common symptoms is when you have hypothyroidism, usually experience like cold hand and feet. So it helps your body to maintain normal temperature. Of course, it's help with growth and development, especially with the kids. If they do not have enough thyroid hormones, their growth will be delayed. So looking at the thyroid hormones, we have 3 hormones, and we're gonna focus on the first 2 because that's relevant to hypothyroidism. So the first hormone is called thyroxine. It's T4, that's the abbreviation for it. And it's basically 4 atoms of iodine. That's why it's called T4. The second hormone is the triiodothyronine, which is actually T3. It's actually 3 atoms of iodine. And actually this is a mineral we're gonna focus on, and this is the overlooked by a lot of healthcare provider. Make sure you watch the video to the end because I will give you tips on how to get the proper iodine, and it will make sense at the end why you need iodine in your diet or as a supplement. So the third hormone is calcitonin, which actually stimulates the calcium uptake by the bones. So we're gonna focus on the T4 and T3. So when we look at this equation, this is a very extremely simple version of the metabolic pathway of the thyroid hormones in the body. You need iodine and trypsin. Trypsin is an amino acid. With the chemical reaction of the iodine and trypsin, that's creating the T4 hormone. And in order to get the T3, your body has to deiodination, which means is removing one of the 4 iodine atom from the T4, remove it to produce T3. So looking at the normal chemical reaction, your thyroid gland, you need to have iodine for your body produce the T4. By the way, here the trypsin, that's amino acid. It's considered to be abundant, available in the body. There's not a lot of issue with a lot of people with producing trypsin. You can get it from food. The problem is the iodine, and that's what we're gonna focus on because it's really crucial for the function of the thyroid hormone, and that could lead to hypothyroidism if you have deficiency in iodine. So the iodine, you need 4 atoms of iodine to produce the T4, and your body has to remove one of those atoms to actually produce the T3. And the T3, actually the active form of the thyroid hormone that's actually used to maintain all organs function. Your brain, that's why one of the symptoms is foggy memory or poor memory. So it's affected the brain, it affects your lungs, it affects your breathing, your blood pressure, it's everything in the body. So very good example here. I want you to think about the T3 as your battery in your phone. So if your battery in your phone is low, like 5%, you barely gonna make phone calls, emergency phone calls. You're not gonna use apps like Facebook or any other apps because it require a lot of battery function or a lot of battery capability. It's the same thing with the T3 or the thyroid hormone. If you're very low with the thyroid hormone, all your organs, everything in your body is very slow. Your metabolism is very slow. Your thinking is very slow. All your organs are very slow. Your blood pressure gonna be low. Your heart rate gonna be low because you don't have enough energy for your body to work properly. So that's the importance of the T3 in relation to the T4 in relation to the iodine. So when someone labeled as hypothyroidism without looking at the iodine, that's basically not figuring out why. And I will go over why a lot of patients have iodine deficiency in the next few slides. So what the symptoms of hypothyroidism? Low energy, fatigue, gaining weight, poor memory, and actually increase the risk of several types of cancer. And it's compromise your immune system because you don't have enough energy for your immune system to fight viruses or infection that will be affected by the low thyroid hormone, which indirectly low iodine. It's decrease your metabolism, your body temperature will be low, and it will affect your growth. So let's look at the deficiency of the iodine, the symptoms of the deficiency. If you look at these lists, it's exactly the same list as the hypothyroidism symptoms. So I will put it next to each other. So when you look here, the same symptoms of the hypothyroidism is actually the symptoms of iodine deficiency, because iodine is a crucial part of the thyroid hormone that actually help your body to produce enough thyroid hormone. So how much iodine you need? That's a very important question. To answer this, it's a really complicated answer, but we have to look at the studies that done. So one of the reports, they found that the healthy body contained 15 to 20 milligram of iodine. Here's the link for the study. So, and actually I read several reports indicating that your thyroid gland, it actually restore on average 60 milligrams, 60 milligram. Why that's important? Because that will help us to know, are we getting enough iodine in our diet or not? if we know how much the body needs, the amount of iodine the body needs, that will help us to know the chance of getting enough or not getting enough. So let's look here at how much iodine in the food we eat. So look, I did this circle because to emphasize this is mcg, micrograms. 1 gram equal to 1,000 microgram. Remember here we said it's milligram, okay? Milligram is equal to 1,000 microgram. So the best source for iodine is seaweed and kelp, actually. And when we look at the amount of iodine in there, it's on average like 232. Kelp, some of the kelps are like a little bit higher in iodine. If you eat 1 pound of kelp, you probably will get on average 2,500 mcg. We still, even when you get the 25 mcg, you still way off from the 15 to 20 milligram of iodine. Anyway, so this I get this from the NIH, and it used to be the bakeries, they used to add iodine to the dough. That's 40-50 years ago, but it's not occurring now. Most of them, they use fluoride, bromelain, which actually cause iodine deficiency. So that's why I X marked those two categories. The second source of iodine is cod. You can get 158 mcg, and some people say, oh yeah, I get iodine from the iodinized salt. Well, look how much in iodinized salt, 76 mcg. That's not even 1% of what you need on a daily dosage. But here is a problem with the iodine salt. As soon as you open that bottle, the iodine is actually evaporate in the air. So that's actually not gonna get any of that. And looking back, this is 76 mcg, you need 15 to 20 mg. So by looking at this, if you're not eating kelp or seaweed, high amount of kelp and seaweed, very high chance you have iodine deficiency. And what that gonna happen, what gonna do to your body? You're not gonna have enough T4 to convert it to T3, so everything gonna be slow. So when your doctor evaluate the T4 and T3, do not look at the iodine or ask you what you eating to make sure you're getting enough iodine, there's very high chance that something missing here, and it's good to be educated, to be aware of the importance of iodine in this function. And I personally had iodine deficiency, and that's one of the reasons that I provide healthcare provider with the courses, so to help them to update their medical information, so they can figure out the main source of the problem the patient could go through. So from looking at the food source for iodine, you really hard to get enough iodine from the food, especially if you're vegan or you don't eat seaweed or kelp. And you need to have high quantity of seaweed and kelp to really get enough iodine for your body. So the main important question, how to improve your iodine? Well, I will hold on taking iodine supplements for now, because I'm gonna cover it in another video. We don't have enough time to cover it here. There's several forms of iodine. There's ones that are toxic, and iodine should not be taken by itself. We have to combine it with other minerals. Otherwise, it's gonna be toxic iodine. It's not gonna be the best option for you. So I'm gonna go over that in other videos. So the source, you have to take supplements. I personally take supplements, but I usually, before I do that, I do lab work to figure out how much deficiency that I have or the person have, to figure out how much iodine they need. So you can take advantage of Ask ASTR. It's a free online medical evaluation that will help you to figure out the potential of you having iodine deficiency and it's actually the software will help you to know which test you need to do, because there's a lot more tests need to be done to figure out the root cause of hyperthyroidism. It's not only the iodine lab that you need to do. There is TSH, there is free T3, free T4. There is much more than that. It's very complex, so we have that software to simplify it by asking you very simple questions to figure out which lab you might need to get to the root cause of your hypothyroidism. Iodine is one of the main issue because of American diet. It's lacking of iodine. There is other minerals that contribute, but is not as much as iodine. So how much iodine do you need? We have to base it on the lab work. So take advantage of Ask ASTR. Just go to askastr.com, get your free medical evaluation, so you will figure out what you should do next for your hypothyroidism. So if you like this video, just click the like button, and if you have any question, comment, just put it on the comment below, and I will answer it in a future video. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to astrinstitute.com.